So we're talking about wounds healing and tissue repair, and this is the first section. In this section, we'll take up the normal healing of the human body. We'll see how a wound occurs in the human body and what mechanisms are activated to repair the body of this wound. We'll talk about the wound healing and factors which are affecting the wound healing. Then we'll be talking about the phases of wound healing, and finally, we'll talk about healing in specific tissues. So, what is the mechanism or what is the process of wound healing? So, wound healing is a mechanism whereby the body attempts to restore the integrity of the damaged or the injured part. So an injury has occurred to the body, and now there's several mechanisms in the body that are activated to prevent further injury and to repair the injury that has already occurred. There are mechanisms that are also activated to prevent any infection in that injury and to prevent that infection from getting into the body as well. So it's a complex that is activated whenever a wound occurs, or a wound when there's an injury to the body, and this complex helps prevent the body from helps prevent that wound from getting fatal towards the body. So, what are the various factors that influence the healing of wound? Obviously, an immunocompromised patient would not be able to heal the wounds properly. Similarly, a patient who's not well fed, who's malnourished, who's obese, or there may be any other pathological state in the body going on, the wound healing would not be optimal. Chronic disease conditions, cachexia, such conditions also prevent the normal healing of the body. Let's see what these factors are and how they influence the body. So first of all, the site of the wound. The site of the wound is very important. If the site of the wound is in such an area which is highly vascularized, the wound would be the repair of the wound would be early and fast, and you'll be able to take care of that wound. If the wound is in say on your face, you'll be able to care more about that as compared to when the wound is on your back, when you cannot see the wound, or when the wound is at your feet. You are not able to care for that wound that easily. Then the structures involved in the wound are very important. When there are deeper structures involved in the wound, there can be the process of healing would take a lot of time. Similarly, a superficial wound would heal early as compared to a deep wound. Then the mechanism of wounding is very important. Now, a clean cut wound by, say, a scalpel or a knife would heal easily as compared to a dirty, contaminated gunshot wound, which would take a lot of time to heal. Moving this mechanism of wounding, it includes incision. We've talked about it before. Then a wound which has a lot of crushing of tissues, it releases a lot of toxic substances in the environment of the tissue. As a result of these toxic substances, they have a lytic effect on the surrounding areas, and these areas take some time to recover themselves. So the process of healing takes a lot more time in a wound that has a lot of crushed tissue in it. Now, a crushed avulsion, when the upper layers of the skin are separated from the lower layers, now in this condition, the deep lying structures of the skin, the nerves, the bones, they are exposed to the exterior. These structures usually require a skin cover, and in these wounds, the healing process is delayed because of the avulsion, that is the removal of the skin cover. Now, moving on to contamination by the foreign bacteria or the foreign bodies. So I gave you an example before. In a gunshot wound, there's a lot of crushing, there's a lot of contamination of the wound. As a result of that contamination, you need to remove the contamination so the process of healing can occur. Whenever there's a lot of contamination in the body gets a signal that there are a lot of foreign invaders in the area. So the body would be in a constant state of war, and when there is war, there is no repair. There's a lot of damage going on. So the war has to stop so that the repair can occur. So removal of these contaminated parts or particles or the foreign bodies is very important. Now this contaminated area can be seeded by bacteria, or the bacteria themselves can be the contaminants in the area. So these bacteria need to be addressed so that the wound healing process can start. Now, loss of tissue. This is very important. So, if an injury occurs in such a way that there is a loss of tissue in the body, now this tissue cannot be compensated by the remaining tissue. The remaining tissue might undergo hyperplasia to compensate for it, or it may take some time and make up new tissue. However, this process is time taking. So at that point in time when injury occurs, the body cannot compensate for it, and it takes a lot of time for the body to readjust to the new scenario and the loss of the tissue itself. And then there are local factors, obviously. In a site of injury, it's very important that that site must be healthy. It must have adequate blood flow. It must have adequate oxygen supply. Say that area is gangrenous, that area does not get sufficient oxygen or blood supply. So these factors might affect the wound healing process. These include the local factors I was talking about include vascular insufficiency. It can be arterial or venous. I've talked about it. Then the area can be exposed to previous radiation. A radiation exposed area is not rapidly proliferating, so this area might take a lot longer to heal as compared to other areas. Then if the area is in constant pressure, if the area is under constant pressure, this constant pressure would not allow the cells to relax and heal themselves. So relief of this pressure is very important for the body to heal itself. Now, systemic factors are also important. The systemic factors include various disease processes that are occurring in the body, the hormonal imbalances, etc. These are important because the body as a whole is trying to heal itself. If a certain part of the body is not well, the entire body would help. The entire body would direct itself to help that part to heal itself. However, if the body has some pathological process going on side by side to that injury that has occurred to the body, the task force of the body, the building blocks of the body would be divided into two parts. Hence, the process of healing would take a lot of time. So the systemic factors, they include malnutrition or vitamin and mineral deficiencies. These provide the building blocks for the healing process. And if these building blocks are not there, the healing process would be delayed. Then moving on, we can have chronic diseases like diabetes mellitus. These diseases prevent the body from normal healing as they take a lot of task force of the body. Then we can have medications like steroids. Now, steroids they take the body to a hypermetabolic state. In a hypermetabolic state, the body cannot heal itself that well. Now, we can have immune deficiencies, like in patients with chemotherapy and in patients with HIV and AIDS. These are immunodeficient patients. Hence, they can acquire opportunistic infections and the body cannot heal itself as well. Now, smoking is obviously injurious to health. It has a lot of carcinogens, and there are a lot of carcinogens in the cigarette smoke. So it is definitely not helpful for the body to heal itself. Now, the phases or the process of normal wound healing. So it is said the process of normal wound healing has three major steps. There's the proliferative phase, the inflammatory phase, and the remodeling phase. Before getting into these phases, let's talk about the pre-proliferative phase, sometimes known as the hemostasis phase. So an injury has occurred So an injury has occurred in the body. This is the injury in red. So at this point in time, the injury has caused the blood to ooze out of the capillaries. Now this oozing of blood sends signals that there's a leak in the vascular system. This signal activates the complement, the coagulation pathway, and the coagulation pathway, it activates the platelets. Now the platelets, they attach themselves to the endothelium of the vessel, and as a result of this attachment, the platelets become sticky and they attach to themselves as well to the endothelium of the vessel. Now they form a platelet plug. This formation of platelet plug then finally converts it to a blood clot, and this clot prevents further leaking of blood in that vessel. So before the process of inflammation, the process of wound healing starts, it's important to plug that leak that has occurred in the vessel. So this is the process of hemostasis. That is, a blood clot is formed in the area of the vessel where the leakage of blood was taking place, so that further leakage cannot take place. So let's move on to the phases and see what these are. So first of all, we have the inflammatory phase. This inflammatory phase, it begins immediately after wounding and lasts to about 2 to 3 days. So there's vasoconstriction and thrombus formation. So vasoconstriction and thrombus formation is continuing from the hemostasis or pre-proliferative phase. So we have seen that vasoconstriction occurs and thrombus formation occurs. Then the platelets, they stick to the damaged endothelial lining. So the endothelial lining in this area, so the endothelium, the platelets are now sticking to the endothelium because the endothelium has damaged itself and it becomes sticky by the release of vasoactive substances. Now there's a release of adenosine diphosphate. The release of adenosine diphosphate causes thrombolytic aggregates to fill the wound. So now the wound is being filled by thrombolytic aggregates, as a result of which a platelet plug has been formed, and with the help of this platelet plug, the bleeding has stopped. So here you can see a platelet plug has been formed and the bleeding has stopped. Now the platelets, they release cytokines from their alpha granules. So now the cytokines within the platelets are being released. What do these cytokines do? They attract the inflammatory cells. Now these cytokines, which are being released by the alpha granules of the platelets, they are now attracting the neutrophils, the inflammatory cells. These inflammatory cells are the cavalry. These inflammatory cells are the soldiers. These inflammatory cells are the hired guns which will fight the infection if present in a wound. Now, platelets and local injured tissue also release vasoactive amines. Now, the endothelium which was injured, the platelets themselves, and the tissues which are injured, they also release the vasoactive amines. Now, what would these vasoactive amines do? They increase the vascular permeability. Now, why is it required to increase the vascular permeability in an area of wound? That is because the vascular permeability, increase in vascular permeability would allow more of the inflammatory cells to penetrate in the injured area and hence provide greater support to the and greater defense to the body. So this causes the infiltration of the inflammatory cells. So this is all about the inflammatory phase. In the inflammatory phase, the body prepares itself against the infection. The signals for the inflammatory phase are sent off by the damaging endothelium, the damaging underlying tissue, and the platelets that are present there, and they're secreting their cytokines which recruit the neutrophils to come into that area and fight off the infection. So now after the inflammatory phase comes the proliferative phase. So what happens in the proliferative phase? It lasts from 3 days to 3 weeks, so it's an extended period of time. It consists of fibroblast activity. So there's some remodeling going on. This fibroblast will produce collagen in ground substance. So it's laying down the material, the building blocks for new proteins, for the new structures to be formed. There's growth of new blood vessels. So their vasculogenesis, the growth of new blood vessels as capillary loops, and there is re-epithelialization of the wound surface. So epithelium is also being set on. Now, what happens in the proliferative phase? There are three important processes that are going on. Now, the fibroblasts, they are laying down the collagen and ground substance. On the collagen and the ground substance, the damage or the repair tissue is being reformed. Along with it, new vessels are being formed by capillary loops. And along with these new vessels, the top lying, the epithelium that had been damaged is now being reproduced. So, now the fibroblasts, they require vitamin C to produce collagen. Here you can see this is the collagen being laid down. Now fibroblasts, they require vitamin C to produce collagen. So a granulation tissue has been formed. This in pink is the granulation tissue. Now there's increase in the tensile strength of the wound due to increase in the collagen. So at this point in time, after the formation of granulation tissue, the strength of the wound increases, the tensile strength increases. That is because the collagen is being laid down and collagen provides a tensile strength. Now type 3 collagen is deposited in a random fashion. So in the proliferative phase, only the type 3 collagen is being laid down, and this type 3 collagen does not follow a set pattern, rather it's laid down as random. However, the laying down of this collagen provides a tensile strength which is needed to the wound at this point in time. So this was all about the proliferative phase. Now in the end, this collagen, it reduces the surface area of wound over the first 3 weeks of healing. So when the proliferative phase is about to end, or during the proliferative phase, when the collagen is being laid down, the size of the wound, it tends to decrease, and it is decreased, the surface area of the wound is decreased slowly over the period of 3 weeks. Now we have the remodeling phase. In the remodeling phase, as the name indicates, there's remodeling of the structures that were laid down in the proliferative phase. So it is characterized by maturation of collagen. So the most important process that occurs in the remodeling phase is the maturation of collagen. Now the type 1 collagen is replaced by type 3 collagen until a ratio of 4 to 1 is achieved. A ratio of 4 to 1 is present in the adult human body, so unless this ratio is achieved, the remodeling process is not complete. Now, realignment of collagen fibers occurs, and this realignment is along the tension lines. So along the tension lines, now the random collagen fibers are being realigned. There is decrease in the wound vascularity, and there is wound contraction due to fibroblasts and myofibroblasts. So here you can see in yellow, these are the myofibroblasts. So as a result of these myofibroblasts and the fibroblasts themselves, there's contraction of the wound as well. So the neovascularization also decreases, and there's contraction of the wound, so the wound decreases in its size. So there's increase in tensile strength of the wound, and it's maximum at 12th week post-injury. At about 12th week post-injury, the healing process has completely occurred. Now the remodeling process has almost completed. At this point of time, the wound is at its most or the maximum tensile strength. So now let's talk about wound healing in specific tissues. First of all, we'll take up the bone. So the process of wound healing, it's the same. It uses all the same phases: the inflammatory phase, the proliferative phase, and the remodeling phase. However, in specific tissues, there's specific additions to these processes. So in bone, there's periosteal and endosteal proliferation, which leads to formation of the callus. So after the inflammatory phase, there's proliferative phase, in which the periosteal and endosteal proliferation leads to the formation of callus. Now, immature bone, it consists of osteoid itself. Osteoid is an immature bone matrix that is converted to mature bone matrix when the bone matures itself. Now, during the remodeling phase, the cortical structure and the medullary cavity are restored. So these were the important changes that occur in healing in bones. The important process to remember is the periosteal and endosteal proliferation. So there are some other changes as well. So if the fracture ends, they are rigidly fixed. That is the fracture, and they are fixed rigidly to each other. The callus formation is minimal, which leads to primary healing. So let's say this was a bone, and the fracture has occurred now. So these are the fragmented segments of the bone. Now, if you attach these segments rigidly, that is, you fix these segments rigidly together like this. Now they're rigid, fixed together segments. Now the bone would heal with primary healing because there's no callus formation in between. The bone segments that were broken down, they're brought together very strongly, very rigidly. There's no callus formation. So the bone would heal itself with primary healing. However, if these broken segments are attached in a random non-rigid way, or if there are gaps in between like this, there are gaps in between, so what would happen? There would be callus formation, and the bone would heal by secondary healing. This can lead to delayed union, non-union, or malunion. These are three important healing deficiencies or healing defects that can occur in a bone, and they can occur when there's non-rigid union of the bone itself. So this was all about bone. Let's move on to the nerve tissue. So now, distal to the wound, there's Wallerian degeneration. So distal to the wound, there's Wallerian degeneration, and nothing can be done about that. However, proximal to the wound, the nerve suffers traumatic degeneration as far as the last node of Ranvier. So what is node of Ranvier? This is the node of Ranvier. Node of Ranvier is the space, here you can see, where these pink lines are ending. This is the space where a saltatory impulse, a jumping impulse, jumps from one point to the other. This is the point which conducts the impulse and causes it to jump to the next point, hence providing high velocity to that traveling impulse. Now, proximally, the nerve suffers degeneration to the last node of Ranvier. Now the regenerating nerve fibers are attracted to their receptors by neurotropism. It's similar to the chemotropism. The regenerating nerve fibers, they orient themselves in the direction of their receptors by neurotropism, and this is mediated by growth factors, the hormones, and the extracellular matrix trophins. So overgrowth of these, coupled with poor approximation of the nerve ends, it leads to the formation of a neuroma. So this was all about nerve. Now let's move on to the tendon. So in tendon, there is two types of repair. There's intrinsic repair. It consists of the vincular blood flow and synovial diffusion. With the help of this vincular blood flow and synovial diffusion, the intrinsic repair of the tendon, it takes place. The extrinsic repair, it depends on the formation of fibrous adhesions between the tendon and the tendon sheath. Now, the formation of these fibrous adhesions between the tendon and the tendon sheath can be problematic sometime as well. So we ask the patient to actively mobilize himself to limit these adhesions, so that the range of motion of the body cannot be limited. Now, tendon must be protected by splintage in order to avoid rupture of the repair. So once you have repaired the tendon, now you have to to provide a splint to the tendon so that it is not ruptured after or post repair. So so the limb has to be kept in a specific certain position with the help of a splintage to prevent further repair of the tendon. So this was all about this section. In this section, we talked about various processes of wound healing. We talked about how the mechanism of wound healing goes about itself, and then we saw various specific tissues, and we talked about how they heal themselves. I hope you understood and liked this section. For further sections, keep watching sqadia.com.